Relax the upper body. That was a really big one. Yeah. You okay?
Yeah, I'm good.
Good. Awesome. Scooch the hips towards me, please. Thank you. Drop this. Nice. All right. Big breath in. All the way out, all the way out. All the way out. Roll towards me. Relax the upper body. Here we go. Oh. Thought there was another one hiding, but not the case. Second thing that I need is to just do it by surprise. Right into your hand. Good. There we go. There. Needed the old 1-2 on that side, but got it done. Jordyn, very good to meet you today. Thanks for coming in.
Thank you.
Jordyn is a friend of my social media director, actually, and she's in today regarding some kind of full back complaints that she's been dealing with for a while. I'm going to let her kind of walk us through exactly what those are, though. So, Jordyn, why don't you inform us a little bit?
Yeah, I would say, first of all, I'm pretty addicted to the phone.
Okay.
So I do get a lot of the neck and the upper shoulder pain. I would say that's probably more muscular. And then sometimes I'll get kind of this mid-back around the shoulder blades pain. And then I've always had a really bad lower back.
Lower back, okay. So we got neck, we got upper back, we got lower back, pretty much the chiropractic trifecta. But what, so as far as those go, when did you first kind of notice them coming on? Did they all come on separately? Did they all come on together? Was there an onset incident? How long have you had them for? Like, a little bit more info. Like, how long have you had it for, to start?
I wouldn't say there was a particular incident. Probably the lower back started when I started dancing around like 17.
So that's something you've had for a while.
Yeah.
Okay, all right, 17. How did you manage it since then? Like, how have you managed it, if at all?
I went to a chiropractor for a while.
All right, yeah.
And then I went off to college for musical theater, and it got a bit worse. And then I didn't do anything there because I was away from home.
So were you dancing during your musical theater program still? Was that aggravating your low back?
Sometimes,
Sometimes, yeah, okay. Now, if you were to go dance now, would you get aggravation of the low back complaint?
Perhaps.
You're not
Depends
sure,
on the day.
Okay, yeah.
Sometimes it's the
calf, sometimes.
calf.
Okay, all
Sometimes it's nothing.
Did you ever get a diagnosis as for why the low back was harming you at such a young age, or?
Not that I remember.
Okay, all right. That's fine, all the same. All right, now regarding the upper back and the neck, is that more of a recent thing, or has that been kind of the same timeline?
I would say that I've always had neck pain from a young age as well.
Okay.
But in recent, like the past few years, probably since I've had the desk job.
Spiked up, yeah. So that was going to be my next question. What is it that you do for a living? Because I know that you do musical theater, but I don't think is that your full-time job? Like, what do you do?
I was working as a receptionist.
Receptionist, okay. So pretty textbook desk job, you know, checking the phones, checking the computer. Very common. Receptionists, all desk workers gets that lower neck, upper back stiffness. We refer to that as student syndrome or corporate syndrome. Medically, it's referred to as upper crust syndrome and presents typically with a forward hunch, which isn't always there, but that's the telltale classic sign. That being said, we'd have to check her first to see if that's actually the case before we make any calls there. How long have you been working as a receptionist?
Over 3 years.
Over 3 years at the same spot, or?
I've had 2 receptionist jobs.
Okay, 2 receptionist jobs, okay. And during those, do you find that, like, while you're working, those complaints get aggravated?
Oh,
like,
sometimes.
Okay, so like after an 8-hour shift or whatever, you're definitely feeling worse than when you first went in.
Yeah.
Okay, all
and
right.
I might get the headache.
And you get the associated headaches too. Okay. Associated headaches with work, upper back and neck pain with work. The lower back's been going since age 17. Dancing seems to aggravate it. Never got really a firm, this is why this is happening to any of those complaints. No? Okay. That's what we can do today. All right, we'll do a physical exam. We'll try to figure it out and figure out what plan of treatment should work best for you, okay? Any questions about those things? No? Awesome. Then we'll get into it. So Jordyn was citing discomforts in all 3 of the primary areas of the back, the cervical spine, the thoracic spine, as well as the lumbar spine. So obviously we need to do a range of motion exam for all 3 of those areas. So Jordyn, we're going to start you off just by bringing your chin down to your chest for me. Now, does that provoke any of that discomfort back here that you were talking to us about?
No, not today.
Particular? Okay, now if I were to do something kind of mean and push this further down, does that provoke it at all?
Yeah.
A little bit?
A
Okay,
little.
I'm going to get you to come back up. Look towards the ceiling for me, please. How's that back here?
That's good.
That's good. And once again, something kind of mean. How's that? It's okay? Or worse?
It pinches a little toward the bottom of the neck.
Can you point to that for me? Towards the bottom of the neck? Okay, so she's pointing right to the CT junction. Okay, we're aware that the CT junction is where the neck becomes a thoracic spine. Now, the 7th cervical vertebrae, which is the bottom cervical vertebrae, has the most prominent spinous process. That's the pointy part at the back, which then means that that's why you have a little bony thing at the back of your neck, very base right there. That's directly where she's pointing, so that would be the CT junction. I'm going to get you to rotate as far as you can to the right side for me. Perfect. So with this, we can get to about, I'll call that 55 degrees, maybe 60. I'll get you to rotate as far as you can to the left, please. Okay, here we get to 50 degrees. So there's an asymmetry in rotational ability. She can't get as far as she can to the left as compared to the right. Very common. It's not that great, that great a difference, but very common that we see these asymmetries. You should tilt your left ear down to your left shoulder for me, please. Okay, here we can get to about, we'll call that 30 degrees, and right ear to right shoulder. Oh, here we'll call it an easy 45. So a lot further to the right as compared to the left once again. So definitely having some difficulty moving to the left. Now, that could be for multiple reasons. Which side do you typically feel tighter on, your left or your right? If you can even notice a difference. If you can't, that's okay.
Probably left.
Probably the left side, okay. So feeling through the left, comparing to right, to my hands, right feels tighter, but patient report is important, okay? If she is perceiving more stiffnesses, more pains on the left, we need to examine that side equally. So next up, we're going to do the thoracic spine. So I'm going to get you to give yourself a tight hug for me. You've probably earned it. Tight, tight hug. And I get you to rotate as far as you can to the left, please. So this is pretty good. We can get to about 60 degrees with that. Now rotate as far as you can to the right, please. A little bit less, so we can get to about 45. Good. And now lastly, I'll get you to stand up for me. You can relax your arms, by the way. And unless you want to keep hugging yourself, if you want to, go right ahead. But that's a joke. I'll get you to bend down, touch your toes for me. You get any discomfort in the low back with that?
Not today.
Good, love it. And now I'm going to get you to bend back up. You're going to come back the other way. I want you to extend backwards. You can look at me if you don't know what I'm talking about. No, you got it right there. Perfect. Any discomfort with that?
No.
Nope, perfect. Love it. All right. All right, now an important part of every physical exam, I've said this many times, I will die on this hill, it's a physical exam, so you need to physically examine the patient. One of those things includes putting your hands on them to feel through their structures. So we're going to start at the bottom of the spine here. Lumbar spine, sacrum. Sacrum connects into the ilium, also known as the hip bones. SI joints. We'll start down here, pressing through the left and then the right side. Now, does one side, like historically with you, Jordyn, do you get more discomfort on one side of your low back versus the other, or is it pretty dead center, or where are you feeling it usually?
I would say it's always in the center.
Always in the center, okay. Feeling through, to me, she's feeling quite stiff on both, like to an equal degree. So usually whenever I'm feeling somebody's low back, there's an obvious asymmetry, all right, where one side will be more stiff than the other. Usually that's right, just because that's the way that people are. In this case, they feel symmetrical, which you think is a good thing, but they both feel very, very stiff as compared to somebody right off an adjustment or a massage or an exercise routine. So that's something that I probably want to work both sides. That also syncs up with her saying that she gets that discomfort central. If you're getting an issue on both sides, the brain can perceive that as central. Let's go ahead and move up the chain here. Okay, now we're getting up into the thoracolumbar junction. Once again, we're meeting a lot of tightness. Like, how does that feel? Oh, okay, so actually, that just released right under my thumb, just with that much pressure there. So lots of tension in the TL junction. Again, anytime we hit a transitional zone, we get those shearing forces that are absorbed, which distribute along that level. So very present here as well. Transition zone, transition zone. Let's go up and check out this one, because I have a feeling that's going to be tight as well. So we're going up the T-spine here. Okay. A little bit on the right side, but not as bad as the TL and the SI for certain. Just going to bring the mic closer just in case we get an accidental release here. Now, one thing that I like to do as a chiropractor is make sure that I do largely what's anecdotally referred to as warm adjustments. Okay, that's not a thing. If you Google it, you won't find anything. But the difference between a cold and a warm adjustment is whether or not you've quote unquote warmed up the body beforehand. So I like to do a lot of osteopathic stuff, mobilizations per se. What that means is that, Jordyn, I'm essentially going to try to stretch everything out back here before I actually try to adjust or quote unquote crack you. Okay. That makes sense because you want to work through those more pretty tense tissues, especially if you want to get through them initially. You want to relax these guys. That just makes your job easier as a practitioner. That makes it easier feeling on the patient, and I think that's the more important part because the patient, it's all about them, right? Yes, as a practitioner, you need to take care of yourself too, but if they're not having a good time, if they're in pain with your techniques, you need to change your techniques up. That's simple. So I'm going to start just by putting my hand kind of on your hip right here, and I'm going to press in through this. I'm also going to be a little quiet during this because sometimes people release. So now, if for whatever reason me doing this is painful, you let me know and I'll back off. Okay? You can say the secret word of "ouch, that's painful." There's one. Here and drop. Good. And I'm just doing the same thing on this side that I did to her other side there. One more. Okay. So Jordyn, I am going to try to adjust up through your thoracic spine now, okay, because it's quite tight. You've been adjusted before, but it was a long time ago. You said probably 10-ish years or so, 10 or so years ago. I've said this to other people, I'll say it to you too. The first time you adjust somebody, you never really know how much force is needed, okay? I've had 350-pound bodybuilders on this table, and I could basically sneeze on them, they would release. I've had 100-pound ballerinas on the table, I need to body slam them, okay? So with you, I'm obviously going to start light. We're not going to start with a body slam, but if it doesn't go, then I'm going to add a little bit more force to it, okay? So to start, I'm going to get you to take a big breath in for me, and then all the way out, all the way out. Good, good. Good. Again, all the way in, all the way out, all the way out. Good. So those are pretty easy. How do those feel? You okay? Mm-hmm. Good. Tension on the right. Let's see if we can get this thumb move over here. So yeah, I'll get you just relax that shoulder. A thumb move targets specifically the transition zone of the CT junction. Okay, I'm taking my thumb, literally. I'm contacting that aforementioned very prominent spinous process on the C7, and I'm going to push through to the other side. All right, let's see what happens here. Good, you just relax for me. There we go. There was a really subtle click there. I don't know if the mic picked it up, maybe it did, but that one definitely needed to go as well. And how was that? That was okay? Mm-hmm. Love it. Perfect. So as I stated beforehand, Jordyn feels that kind of central discomfort there in the low back, but also is very stiff to my hands on both sides. So there it's prudent to obviously be adjusting both sides, kind of in the same area. Now, obviously, I adjust both sides in a lot of my patients. To you guys, that's going to look very similar. The contacts, also known as where I place my hand, differ ever so slightly. Usually I'll do an SI adjustment on one side, and I will open up the lumbars on the other side, all with the intent of opening up one-sided L4, L5. I know that doesn't make sense if you're not a practitioner, but if you're a chiropractor, you'll know exactly what I'm saying. But in this case, I think it'd be prudent to open up the lumbars on both sides entirely. So what I'm going to do here is I'm going to bring this leg up. I'm going to take this. I'm going to pull this so you're off your shoulder, even though you're laying pretty well already. Hand right there. Nice. I need you to scoot your hips a little closer to here, please. Thank you. You're going to just camp out right there. You comfortable? Or as comfortable as you can be? Perfect. All right, now what I'm going to do is I'm going to take that contact on the lumbars. Take a big breath in for me. All the way out. Good. Breathe on out. Relax the upper body. That was a really big one. Yeah. You okay?
Yeah, I'm good.
Good. Awesome. Now we're going to do the same thing on the other side. Okay, and here we are going to open up the other side as well. So we're just going to get her into position. Bring this leg up. Scooch the hips towards me, please. Thank you. Drop this. Nice. All right. Big breath in. All the way out, all the way out. All the way out. Roll towards me. Relax the upper body. Here we go. Oh, thought there was another one hiding, but not the case. All good. We're going to come on in. So once again, Jordyn was saying I'll get you to drop the head. You just let me hold you entirely, okay? That she gets most of the tension kind of down in that base. How do you feel? So, well, I'll tell you how you feel. At the base, you're quite tight for certain. But then as we go higher, how do you feel? Because you said you do get headaches too. How do you feel as we get to kind of the very top, like in through there?
Definitely some pressure there.
Not great. And then what about on the left side? Not as bad, or is it just as bad?
I'd say it's about the same.
About the same? Okay. So without doubt, Jordyn's greatest stiffnesses and tightness or pains in the neck are lower down to both her report and my hands. Love it when things sync up. As we go higher up, we do have some tension in those suboccipital muscles for certain. Oh, that's worse back there.
That's it, yeah.
Okay. So we're going to be addressing basically full neck, both sides. I want you to try to give me the weight of your head as much as you can, okay? I appreciate you trying to help me out. I can definitely support the weight of the head. So, drop, drop. It's so hard to let go. I know people are used to just holding their own head up, but let's do this side. Drop, drop. Good. Okay, so we're going to adjust that left lower side right now because I really feel like it needs it. So I'm going to move this over here. I'm going to take this. And I want you to just drop your head into my hands for me. Good. Now I need two things for this to go smoothly. Okay, the first thing is for you to just relax the head into my hands like that. Good. The second thing that I need is to just do it by surprise. All right, so I had a nice little release right there. Let's take a look. That's the other side now. Drop, drop. Good. Good. And I want you to relax that into your hand. Good. There we go there. Needed the old 1-2 on that side, but got it done. So those are actually, Jordyn is a much harder adjustment in the neck than I anticipated her to be. I like to pretend that I have a sense of how well someone's going to release, but even after years of being in this profession, it's very, very difficult to predict just how well somebody is going to release until you just try it. That being said, I am pretty convinced there's more work to be done in this neck just because it still does feel quite tight, especially in the top area right there still. We're going to try one more time the very top this time. So previously my hand contact was much, much lower, as you can see down there on camera. Now we're going to be much higher towards the top, see if we can get any more movement in there. Turn to the left, good. I want you to drop once again into my hand, nice, good. More work to be done for sure. That's okay. I'm confident in our ability to get into the next one. the next appointment, not the next adjustment. We never push through these things, guys. Yeah. So once again, Jordyn was tight very much in the transition zone where the thoracic spine becomes the lumbar spine. Okay. So was the SI joint, slower down in the lumbars. And some up here in the CT junction, but especially more so out towards the levator scaps and the upper traps. So with that kind of generically spread out tightness everywhere, bam, we're going to use the tools that we like to use on pretty much every available opportunity. So Jordyn, at this time, I usually like to ask my patients a question about themselves just to give them a chance to connect with the audience and the audience can get to know them a little bit better. So my question for you is to tell us something about yourself for which you are proud of. And I think I know what it's going to be already, but the people watching probably don't. So why don't you go ahead and fill us in?
All right. I'm very proud of my involvement in community theater. I've been with the same group for 8 years now.
8 years.
8 years, 12 shows, I think. And I've been the dance captain for pretty much all of them.
Okay.
I love to dance. I love to help people dance. And my favorite part is watching the kids grow up. Like, when I first started, there were a bunch of kids who were like 10, 11, 12 years old. And you know what? They've kind of grown with me as I've helped them dance throughout
Aww.
the years. And now they're like 17, 18, and they are so cool now. They're like way cooler than I am. And it's cool to see like how much they've improved, whether it's with dancing or anything else. And I just love seeing them grow up.
Aw. I'm getting some like proud aunt vibes.
Yeah,
like that's what I'm getting right now.
I think a few of them would say that.
Well, that's good. See, the importance of having like a mentor or a teacher or a role model in these situations, especially when you're 12 and about to plow through the very confusing teenage years, it can be very grounding to people, okay? We can read all the time about teens who end up getting involved into some pretty incorrect or just wrong, I'm going to swear here, shit, because they don't have anybody to really lean on, and sometimes a parent isn't always the first person that these kids can turn to, right? So like your role as a dance captain or as the person who, you know, if they can call you like that happy aunt now, like don't underestimate the profound effect that can have on somebody's life, okay, to have that kind of positive impact during the formative years. So hats off to you, genuinely, you're proud of what you've done, and it's also important. Nobody should underestimate that.
Thank you.
I got you.
Mm-hmm.
And do some to the back of your neck proper too, okay?
Okay.
There you are. So the last thing we're going to do today, another staple on this channel in addition to the tools, is the MRT, or the pointy elbow into the tight musculature. Again, we're complaining of that neck, upper back pain, so I'm going to get you to start by looking up and to the right for me. Now, full disclosure, this is usually the part where, you know how I say during the informed consent process you might be sore afterwards? It's usually this or the tools, and it's usually this, okay? But for this, what I'm going to get you to do is look up and to the right, and it's your contact. And I'm going to get you to slowly look down to the left for me, okay? Good. Now, how does that feel? Is that okay? Is that tolerable?
Yeah.
Okay, good. Up to the right. Down to the left slowly. Oh, okay. There it is.
Yeah.
Yeah, keep going as far as you can. So MRT, or myofascial release technique, is an, in my opinion, very effective form of massage. Up to the right. Down to the left. Because it works both the myo, also known as the muscle, and the fascia, which is something that I absolutely love on this channel. MRT involves having the patient bring the muscle into a contracted or shortened position. Elbow goes on the muscle, and then I get the patient to stretch against that pin. So down to the left, and it feels like something's happening. That's because multiple things are happening. Fascia, myo, right? Good. Face up to the right. Last one. And slowly down to the left. Go ahead. Ooh, that's a nasty one. Good. Awesome. Face forward for me. Please tilt your right ear to your right shoulder. Good. Now we're going to tilt our left ear to our left shoulder. Good. Right to right. Slowly left to left. I should have said slowly the first time. Good. Right to right. Left to left. Right to right. Left to left. And right to right. Left to left. Good stuff. Awesome. Good job.
Ooh.
Bad news. You have two sides. So we're going to get you to, I'm going to move the mic, so not that it's really necessary. I'm going to do it anyways, just that it's over here. And I'm going to get you to look up and to the left for me, please. And slowly down to the right. Go ahead. Up to left. Down to right. Up to left. Down to right. And up to left. Down to right. Good. Face forward. To the left ear to left shoulder. Slowly right to right. And left to left. Slowly right to right. Left to left. Slowly right to right. And left to left. Slowly right to right. Alright. Good job.
Yeah.
You survived. Jordyn, what did you think of all of that?
I thought it was great. I definitely feel looser already.
Good. I hope so.
Opened up.
Yeah, that's the first time you've ever had both those tools as well as kind of that MRT, that elbow, used on you before. Is that correct?
Yes.
Yeah. Have you seen a massage therapist before?
I saw one toward the end of last year.
Okay.
And
Do they do either of those techniques on you or no?
no.
No. Okay.
I've never had either of those.
Interesting. And the chiropractor that you saw years before, did they use anything similar to those techniques on you as well?
No, just the cracking.
Just the cracking, okay. I've said this many times. I think it's really important that the professionals that you choose to include in your life, not just in healthcare, have a diversified toolkit, meaning that they're experienced in multiple different avenues of resolving the same problem, okay? That's important because if for whatever reason Jordyn here wasn't responding to the cracking, well then we do heavy massage, and if she didn't respond to the massage, well then we do heavy physical therapy, right? I will die on that hill, that is very important, that you, if you're going to give somebody your money, make sure that they have multiple different ways to fix your problem, unless of course it's one of those, there's only one way to fix this, but let's not get into specifics here. Glad you're feeling better. Do you have any questions for me at this point in time at all about either the things we did or what you should be doing or anything at all?
I'd be interested to know what we would do if we followed up.
Good question. So you have lower back tightness that's kind of, we're not 100% sure where that's coming from. Okay, we do a little bit more investigation, get a confirmed diagnosis of that, absolutely. The upper back and the neck, you're probably correct in that it's related to the desk job and the posture you're maintaining for a long period of time. Okay. There is actually no such thing as bad posture. A lot of people think that there is. This is not true. It was the prevailing mindset about 15 years ago. We've started to shift away. If you guys watch me from the side, I typically sit like this, okay? Not great posture. I'm a chiropractor. But the thing is, what we found to be more of an exacerbant is remaining in a stationary position for a prolonged period of time, okay? What that means is that if you're like this all the time at your desk, yeah, you're going to get discomforts. If you're like this all the time at your desk, you're going to get a different set of discomforts. Instead, it's more important to be regularly changing those things up, okay? You're already a dancer, all right, which is phenomenal. Dancing is one of the best forms of exercise a person can do for both cardiovascular fitness as well as their own muscular fitness, which is good. That helps to improve your mobility and make sure it's there. But it doesn't matter what you're doing exercise-wise if you do this 8 hours a day, right? Doesn't matter, right? Or if you do this 8 hours a day. So instead, the more important thing is that while you are doing that thing for 8 hours a day, you're consistently moving and changing up the posture every 30 or so minutes at a maximum. So what I usually recommend to my patients to address the root cause of these kind of postural issues is an app. Actually, it's an app called Focus Keeper. I've made an entire YouTube video about it. It's one of my earlier talking head videos, but we'll leave a link to it up in the corner there. And the gist of it is that Focus Keeper gives you a 25-minute reminder, very gentle, non-intrusive chime, okay, because I hate setting my phone alarm. You're focusing on something, you're trying to get back into it. This doesn't interrupt your flow state, okay. You change your posture up, and then it checks in again 5 minutes later to make sure that you've stayed changed and just revert back to where you were. Okay. The patients who've used this for the purpose of postural modification, they absolutely swear by it. It clears up their complaints almost instantly because it resolves the problem, which is behavioral in nature rather than structural. So I'd highly recommend that, and I can walk you through that if that's something you're interested in taking home with you today. It is free. I'm not affiliated with it in any way. It just works, which is why I recommend it. That is one thing that I'd want you to start implementing. What I could do for you on an ongoing basis would be those regular check-ins. Now, people who regularly see a musculoskeletal professional, either a physiotherapist, a chiropractor, an osteopath, a massage therapist, whatever, are at less of a risk of injury, and when they are injured, are less severely injured. Outside of, obviously, trauma. If you're in a car crash, that's going to hurt no matter who you see regularly, right? Therefore, it's up to you to determine whether or not that's worth it. Of course, I'm here, and if you are having a particularly stiff day, I can loosen that up the same way any other massage therapist or physio would be able to, right? It's about that ongoing proactive care, whether or not that is in line with what you were trying to obtain, right? So what I'd recommend to you right now, I could see 2 or 3 more times, try to clear up the stiffness as much as possible, and then you make the decision. Is this something you want to pursue to try to maintain that quality of life aspect, or is it really not that much of a priority to you right now? You can give me a call whenever you need to, right? That'd be my recommendation. Does that answer your question? I got really sidetracked and on a tangent with that. Okay, good. Any other questions for now?
I think I'm okay.
Awesome. All right. Well, thank you so much for coming in, Jordyn.
Thank you.
Really great to meet you.
Thank you for your help.
Of course.
Don't forget to like, comment, and subscribe.
Thank you, Jordyn.